Yes, mental health privilege exists. Here's how you can help. As it is Mental Health Awareness Month, we wanted to touch upon the subject of mental health privilege. This type of privilege is often forgotten and misunderstood. In many cases, a person who lacks or has mental health privilege does not even realize whether they have it or not. However, the number of impacts that the lack of mental health privilege has on a person's life is ever growing. Mental health privilege does not have a specific definition. It could be defined as advantages that come with having a healthy mental state. It is often viewed as a subtype of health privilege, which can be defined as advantages that come with having no health issues. The best way to explain mental health privilege is to look at the specific disadvantages that are caused by mental health challenges. Here are some examples. Facing discrimination or prejudice in and outside of the workplace due to stigma around having a mental health illness. Facing anxiety of whether to tell your boss, friend, potential employer, or new relationship partner about your mental illness due to fear that they will not accept you, which could easily rip away new opportunities. Being fearful that you may be labelled as a bad friend due to missing events and/or having to cancel events at the last minute due to a mental health condition. Being fearful that you may be labelled as a bad employee due to missing deadlines, having to ask for help, or asking for extra time. Along with mental health privilege, the access to mental health care is a difficult and long process which only creates more disadvantages for those with a mental health condition. For example, in the UK, the mental health sector receives just 13% of the NHS funding, yet mental ill health accounts for a massive 28% of the overall disease burden. Many people with mental illness are put on a waiting list in which 64% of people must wait more than 4 weeks between their initial assessment and their second appointment. 23% wait more than 3 months and 11% wait longer than 6 months. The long waiting times often increase the severity of a person's mental health condition, creating a longer list of disadvantages which further increase anxiety and frustration over a lack of finance to get the help they need at the time, which ultimately creates an extremely vicious cycle. Experiencing a lack of mental health privilege can feel like power is completely out of reach. So those who have access to change the system that creates the fears that those with mental health challenges may face, such as CEOs, HR managers, and business leaders, we believe should be able to step in before the vicious cycle becomes too dangerous and, in more severe cases, irreversible. So how can you improve the workplace for those who lack mental health privilege? Offer mental health first aid training. Always have mental health first aiders on hand. Train managers and team leaders on what to do if they see signs of mental health conditions. Include mental health coverage as a part of the healthcare plan. Reduce the stigma through events, fundraisers, posters, and communication. Have access to emergency contacts such as Samaritans. Encourage employees to talk in a safe, confidential environment. Enable working from home if necessary. Make changes to break times and enable flexible hours when necessary. Have quiet zones for people to de-stress and reflect. Relax absence rules and limits to those with mental health issues. Allow time off for appointments and short notice leave. Create a mentor program to provide employees with someone to talk to. There is very little data on the use and impact of privilege at work, so help us move with this conversation forward by taking part in our survey. It aims to capture accurate and representative insights into the use of all kinds of privilege. Please take some time to do this survey and become part of the change.